Great. Good to see some audience trickling in. Please be welcome, and I hope more people show up. Good morning. It's really great to be here in Barcelona for one of our first in-person gatherings since the pandemic, and I have also realized I can take my mask off. So maybe this is the mic okay? Okay, fantastic. So good morning and warm welcome to this session. I hope you all enjoyed the day yesterday and maybe had a nice excursion in one of the field visits after the conference sessions. My name is Emily Norfold. I'm here on behalf of EAT, which is a global nonprofit working to transform the food system. After sharing a brief background on the topic today, I will guide us through a series of speakers and discussion. There will also be a chance for Q&A from the audience, so please make note of your questions. A quick logistical note first. The session will be in English, French, and Spanish, so do get a headset if you need translation. Also, in terms of COVID safety, speakers who are seated on stage may remove their masks. To you in the audience, if you wish to ask a question later on, a microphone will be brought to you and held for you, so do not take the microphone yourself, and please keep your mask on. So now let's get going with the topic. Today's session will highlight food-related initiatives cities are taking to address health and obesity. As you all know, food is at the root of the world's biggest health challenges, and is also a driving cause of environmental degradation. Over the coming decades, the global food demand is expected to increase by around 50%, and the demand for animal-sourced food is expected to double. This will leave over 4 billion people overweight and obese, while 500 million are expected to still be underweight. Malnutrition is the biggest preventable disease burden in every country. On the other hand, obesity costs $2 trillion annually, which is about 2.8% of the global GDP. Meanwhile, around 40% of humanity cannot afford a healthy diet. For those of you who joined the opening plenary yesterday, you heard some more statistics about diet and nutrition and obesity-related issues from Pau Gasol in his video about health and nutrition for children. Providing a growing population with enough healthy, nutritious, safe, and tasty food within planetary boundaries while providing decent livelihood opportunities for food producers is a huge challenge facing the world today. But how are we addressing that challenge, and what can we do? Today, we'll hear from several cities and experts who are working on these topics, including EAT, Barcelona, Rio de Janeiro, Lyon, the World Health Organization, and the Gasol Foundation. Speakers, as you know, we're on a strict schedule, so please keep to time. And to start with, I would like to invite Dr. Gunhild Stordalen to the stage.
Thank you, Emily. I'm very proud to be on your team, and thanks for showing up here today in this small, intimate room, but we will have fun. So, 2021 has really been the year of food, and I want to start by sharing some of the main achievements from what was a historic UN Food Systems Summit that happened last month. Indeed, it was the very first time the world leaders gathered at the highest level to address food as a system. And that in itself is really a breakthrough. When we in EAT started our work now 8 years ago, we were basically, or among the very few that were talking about food that way. And this shift in mindset, it might sound trivial, but it's absolutely not. It's really a big thing. I would argue it's the most important lever for transformative systems change. Because when we understand that food is a system, it means that we can no longer address with health, hunger, climate change, environment, and livelihoods. We cannot deal with these issues separately. We understand that these are inextricably interlinked. And that also means that we understand that it's madness that one ministry subsidizes with billions of dollars every year the production of crops or food that are making people sick and destroying our planet. And in another ministry, they are tearing their hairs out because they don't understand why the obesity epidemic is just skyrocketing and why greenhouse gases continue to go up. So this mindset is really a necessary and important first step. The second thing is that through this summit process, we have unleashed a benevolent monster of energy and activity. More than 140 countries have been holding their own national food systems dialogues, and those dialogues have been organized across ministries with all the stakeholders at the table, from farmers to big food to civil society. And that is only now 4 years ago since we in EAT, together with David Nabarro, who you might know, and other partners, were piloting the very first food system dialogues. And think about that for a second. Now these dialogues have gone viral, and that is amazing to see. And already, and this is incredibly important and encouraging, already have more than 100 countries around the world now started their journey on developing national pathways to sustainable, healthy, and equitable food systems by 2030. So in other words, national governments are now finally starting to catch up with you guys a bit at the city level. In parallel, the 5 action tracks set up to shape the summit's agenda have done just that and more. Built on the science and more than 2,500 game-changing solutions, we now have a series of global coalitions, and that together add up to an integrated action agenda for the years to come. And this agenda will help countries, cities, other stakeholders to or provide them with the tools they need to shape their national pathways and help them unlock action at the ground. Important to say, those game-changing solutions did not come from the action track teams. Rather, we crowdsourced these solutions. We involved all and any stakeholder, engaged them, listened, and we invited people from all over the world to come with their ideas and their solutions, obviously vetted by the best available science. And in this process, we have also heard from young people like never before, and about their priorities. And the Act for Food, Act for Change youth pledge that are led by youth from all over the world have already received more than 100,000 individual pledges for food systems change, which is great. And guess what? Their number one priority, all these young people, their number one priority is access to healthy, sustainable food for all people everywhere. All of this is not to say that all is well now, that we have kind of solved the problems. We have not, important to say. And as you also know, we are running out of time. So what we do over the next 5 to 10 years will literally decide the future of humanity on this planet. So we really need to roll up our sleeves, and we need to break the current trend lines within this decade. If we don't, we are on course to a world of much more extremes, a world that none of us, far less our kids and grandkids, would like to live in. And in many ways, we can say that our food fate will largely be determined in our big cities. Because as you perfectly well know, by 2050, 80% of the world's food will indeed be consumed in urban areas. And rapid urbanization has obviously many implications for food systems at many levels. So this means that we simply cannot solve our food systems challenges without strong leadership from our cities around the world. But if we frame this a bit more positively, and we always should, the glass is always half full, as you know, I would say that our cities, you guys, are perhaps our greatest hope. You are big enough to have systemic impacts, and you are small enough to get yourself organized and get stuff done. And what you do in your cities, don't stop at the city borders at all. What you do in cities have ripple effects all the way back to the farm level, to soil health and people's livelihoods in rural areas. I also believe that with the national pathways taking shape now in so many countries, you as cities, you have a fantastic opportunity and a huge responsibility to position yourself as the vanguard of action and to actually make sure and help to make these national pathways happen and to really achieve sustainable, healthy, equitable food systems at the national level by 2030. Many cities around the world are, of course, already working on this and taking important steps to do it. For example, the 14 mayors, including your own mayor here in Barcelona, that signed the EAT C40 Good Food Cities Declaration, committing to healthy, sustainable diets by 2030. In other words, these 14 cities are now aligning food consumption in their cities with the planetary health diet targets coming out of the Eat Lancet Commission. And in total, this declaration is positively impacting 65 million people around the world, which is huge. And another example that we will hear more about while we are here is the Barcelona Challenge, which is open to any city in the world. But we need more cities to join these two examples, including from the Global South, because if we want to secure a good future for humanity, everybody, everywhere needs access to a planetary health diet. And joining the Good Food Cities Declaration or the Barcelona Challenge would go a long way in addressing what we are focusing on here today, to tackle urban health and obesity and social inequality challenges through food. But these initiatives would also help you in tackling the climate crisis and the threatening biodiversity collapse. And as I said in the beginning, when we start tackling these challenges and seeing these challenges as integrated, interlinked, and as one system, that's when we are really getting to exciting solutions. And also when we are going way beyond Band-Aid, but addressing the real root causes of the problems. And we now have the science to say that if we get it right on food, food can be the most powerful preventative medicine for people and planet. So that's why we need to identify the best interventions that cities can implement to tackle these challenges successfully and simultaneously. And obviously why we are here, what the panel today is all about. And let's also think about what you as cities can do to put pressure on national governments, because they really need to step up and start to govern. They need to take lead like they have done now through the pandemic, and cities are key actors to help make that happen. So let me end with a confession of sorts. What we have achieved through the UN Food Systems Summit process, that is great, and it has been a lot. But we honestly have also wasted a lot of time in endless meetings and endless discussions that really have betrayed the urgency of the situation that we are in. Hence why I've taken action myself. I'm not sure if you can see it, but this is my formal proposal for one more SDG, one more Sustainable Development Goal. SDG 18, stop the bullshit. Let's get to work and act on that, and wish you a great panel. Thank you.
Thanks very much, Gunhild, for those great opening remarks and setting the context both from the international processes and tying it down to the urgent need for cities to act, which we know cities are already doing. So with that note, we'll get on to the panel discussion. First, I would like to hand it over to Gemma Tarafa, the Health Councillor of the Barcelona City Council. So the word is yours.
Thank you. Thank you very much, and good morning, ladies and gentlemen. I would speak in Spanish, so you can check the. Buen día.
Good morning, everyone. It is a pleasure being here at this forum. 1 year of being the capital city for food in Barcelona. It is a pleasure being here, therefore. We're so used to wearing the mask. Good morning, everyone. I was saying welcome to the city of Barcelona, and it is a pleasure being here today here at this forum in after a year of Barcelona being the capital city for food. I wanted to start off with one data, which I think shows quite well what we're talking about here today. Those of you who don't know Barcelona, Barcelona is a city that has 10 districts. Some have higher income, others have lower income, and they are spread all over our city. The city of Barcelona has 14.8% of children from 8 to 9 years of age with obesity, and 11.8% of girls, same age, who also have obesity. If we look at inequality of this obesity throughout our city, we have districts which have 18% of boys and girls with obesity, whereas the districts with higher income, 10% of those children suffer from obesity. So these data tell us that obesity, all the alarms and all the red traffic lights light up of obesity in our city, which is not different from other cities, but it is a value to be held into account. And this inequality, we have inequality at many different levels in European cities such as Barcelona, but we also have it in respect of obesity. I think it is really important, and we must bear it in mind at Barcelona Municipality that our public policies have to be oriented bearing in mind these data, and therefore we have to bear in mind that food is one of the factors, or the most important factors for health, but food is also, with the data that I just shown, it is much more important, the postcode than genetic code and the gene code, and therefore where we live makes our health be better or worse, and therefore that is also present in food. We know that having a good or bad feeding depends on influences our health, and therefore the health of the world is affected by this. A third of pollution comes from food production, distribution, and consumption. And for those reasons, for the question of planetary health, bearing in mind all these data, in Barcelona we started off with a project called Healthy Canteens, and the 80% of teenagers in our city do not eat enough fruit and vegetables. 78%, and 43% of teenagers eat more meat than they should, and 43% of teens eat more pastry than they should. And therefore, with the Public Health Authority of Barcelona and the network of sustainable schools, canteens, we started off this project. So we started off last year with 6 schools with the goal of decreasing the animal protein intake and to increase the vegetable protein. And we have to look at school menus. And why school? Because it is a transformation focal point in our cities. We can work on habits at school, and we can build on mantras or habits which are very well rooted in our society. We can work with the educational community because we can bring that, translate that into our homes, and we can communicate love for food and understand that they have to have a healthy diet. This is a project we worked on last year with 6 schools of the city and with all the teaching, educational community, that is parents, teachers, pupils, producers, local producers, and local shops, all the network of community, of education community. The results are quite good. And therefore, this year, there's a voluntary inscription, and 40 schools have registered with our initiative, 20% of the schools, with the goal of reaching the 411 schools in the next 2 or 3 years. We have to go forward in this sense because we have to translate this balance in the schools. They're very imbalanced in respect of animal protein.
Proteína animal.
There's no longer animal protein in many of the dishes of these schools, and more vegetable protein, and above all, less meat. This is a project that we must attach value to for 2 reasons: because schools are now beginning to work on this balance, but because it goes beyond schools. It's like opening the floodgates and you fill the educational community, our homes, and other places in the city with this movement, with the intention to grow throughout the city gradually. I also want to tell you about 2 other things we've been working on. At the same time, we've been working on school lunchrooms and local seasonal food. We have to reapproach our relationship between the countryside and the city, where in Barcelona we have so many people living, but also the advertising and marketing of these calorie-rich, unhealthy foods depends on 2 things. One, that they have ease of access and that they are over-advertised. Therefore, we know that this ease of access and advertising are what we call the environmental risk of eating foods that are not healthy for our children. We're working on 2 things. We have a preliminary study from our health agency that says that in low-income neighborhoods, the shops and establishments with high-calorie foods and junk food are closer to schools than in higher income neighborhoods. Therefore, we have to work on how we regulate the sales of high-calorie foods near our schools. We do not have a regulatory framework for advertising, but we are working with the ministry and the state, and we will begin to work in the city of Barcelona to not advertise these high-calorie and unhealthy foods for our children in our city. So I just wanted to share these examples that are about transforming habits. We have to transform many things in our society, and homes and schools are the linchpin through which to change habits in schools, in homes, between the countryside and the city, to rebalance diets. Statistics are all too clear. Our diets are very unbalanced. We have to promote vegetable protein, reduce sugars, reduce sugary drinks, and rebalance our entire city. The indicators are telling us that we have worse results, worse statistics in lower income cities and areas than in higher income cities and areas. So we have to keep working. That's what we will do with this project, and we hope to expand it over the coming years in our city. Thank you very much for your attention.
And it was great to hear the variety of work that Barcelona is doing on school meals and food environments that are really addressing health and inequality challenges. So thank you for those contributions. Now we'll turn to an online participant. Please welcome Andrea Deluca, head of the nutrition department of the Miguel Couto Municipal Hospital in Rio de Janeiro, Brazil. Please go ahead. It seems to be muted on the online side. We can't hear you, Andrea. I'm not sure if you can hear us.
Oh, now on? It's
yes,
okay.
Now it's good. Go ahead. Thank you.
So first of all, I'd like to thank for the invitation. It's a great opportunity to discuss here what we're studying now and doing in our country, especially in Rio de Janeiro, by a sustainable school feeding network that was working on bringing here for discussion. So just to beginning, first of all, I'd like to show you, just to introduce, the mayor of Rio de Janeiro now is Eduardo Paz, the municipal secretary of health, secretary for health is Daniel Suran, and the municipal education secretary is Renan Ferreira, and other co-workers that now join us in this job. So, as I hear now, obesity often is a rapidly increasing data in wide world, no matter in age groups we are discussing now. And what he thinks is that school meals program are the most importable, impactful, and efficient intervention to support children. No matter if you are combating hunger, malnutrition, poverty, or even obesity, since we have in Brazil, especially in many states, the two events, as we have insecurity, we have, on the other hand, obesity and overweight. School feeds now program are another way, an incentive for the families also to keep and enroll children in school. Since 2009, the federal government of Brazil, through a foundation that we call National Education Development Fund, has been leading an issue to promoting public policies that have direct impacts in sustainable food eating by a national school food program, which serve now about 47 million students throughout the country. Since we have the pandemic and children are missing out what they have, yes, one proper meal for the day, now the world that are overcoming and recovering from COVID, we are restoring for school meals program. And we think that's an urgent priority to reestablish and improve in a large scale meals programs. That's what we are working now, a national school food program, in order to develop and articulate actions that we can use between moreover section, improving health and education. So we like and we want to qualify an efficient school meal programs. So what are you working specific now to do that? So we're trying to infantize the access to food in sufficient and quality and quantifies. We are reprogramming our meal programs with health and promoted eating practices, biosocial level growth and performance in development, trying on healthy eating habits and food education actions. Meeting always the participating, including the social and school community, and actions of foodstuff from family farming. I put it on some data just to remind you that here in Rio, approximately 16% of children have overweight and 10% have obesity in the age of 5 for 10 years. In adolescents, more than 15 years, we have 18% of overweight and 10% of obesity, which hides what we are concerned about. So we now have at school 641 children divided in early childhood, elementary school from 4 years, special education needs, flow correction programs, and youth and adult education that are above 15-year-olds. We are working now, and finally this year, our first food guide for scholar and our planning food preparation for children. Analyzing a survey, we found that approximately 44% of children, our children, have an outcome eating meals, which contribute at about 12% of energy intake. In the other hand, we found an inadequacy in micronutrients in all these adolescents in about 70% or even 19% in some micronutrients like calcium, vitamin A, vitamin C, magnesium on females and males children. So what are we trying to discuss now in our food and nutrition actions, actually? The aim of the conception and elaboration and monitoring of food and programming planning would improve quality and control. So as we hear, we are developing food and nutrition education actions, monitoring by the execution that a national program that already exists, that's the National School Food Program that we call PNAA. We are using tools for checking and monitoring this program with systematic training of the managers school units and with the teams and manipulators and the nutritionists. As you know, Brazil has already full guides for adults. We developed now a guide for children with a national survey work. When we have a guide recently, reset is a guide of physical activity that we can use as a base to program what are we now discussing at school. On the other hand, we find that this technical coordination food must be carried out as a nutrition linked to educating departments. Since in the last time did not happen, we have the schools making up the programming of the meals without a nutritionist coordinator. So we found many problems about consuming of meals and a large amount of sugar and a large amount of fat, what makes it a little, and trying to adjust it, what we can do about this planning in another words. For now on, we allocated the nutritionists as a part of the program of technical staff, which is regularized by respective council nutrition in registry of the city. In Brazil, we have two situations. Instead, we have obesity and overweight. We have both insecurity. So we have about 50% children living in insecurity, what makes us also worried about. So we have, in another way, a risk of malnutrition, a bad nutrition, and I have, in another way, overweight and obesity. So we're trying to discuss at the same time the two situations to find a way to work it out in a meal and a program and plan at school that attend the two ways or the pathways that I'm trying to. What we think about now is that figures related to malnutrition and obesity or any level of learning school or school performance need indicators that should be developed in a way to find a pathway to a clear food education policy, which is not easy to do. We think that the best way we can do that is throughout offering a systematic and continuous responsibility of the food and school in order to promote actions to sustainable school feeding network with a positive impact on policies aimed to the team and consequently to construction of a future of new food areas. That's our focus on working now. We have at school many activities that we can develop. Just for a think about what we are discussing here, I think that's important to make a change to a health and sustaining continual patterns that includes a revision of our tests and procedures and proper relocations of resources in order to promote a more healthy food and a more healthy change in our planning, what we work in our school. I'd like to thank you for all, and I think it's a very good opportunity to discuss the exams here with many specialists in team.
Great. Thanks very much, Andrea, for sharing such a rich set of examples and knowledge from your experience in Brazil. And it was good to hear about kind of the efforts in place to kind of monitor and develop indicators as well, and the links to the national policy. So thank you for those rich insights. Now we'll turn back to the stage. Our next speaker is Monsieur Gautier Chapuis, who is the Deputy Mayor of Lyon in France. So please go ahead.
Okay, thank you very much. Muchas gracias. I will speak in French now. Merci beaucoup de l'invitation. Merci de nous permettre.
Thank you very much for the invitation today and allowing me to present my initiative that we are carrying out in Lyon. First of all, if this works properly, I would like to give you a bit of background on the city of Lyon and the metropolitan area in which we live. We have 125,000 inhabitants in Lyon. It's the third most important city in France, and has a metropolitan area of 1.4 million inhabitants. Therefore, the fourth largest metropolitan area of France. As for our food system, we find that 5% of production carried out in the metropolitan area of Lyon stays in the city. 85% is exported. Therefore, there is a major food flight, you could say, of our local products. And just one final figure. In the city of Lyon, we have 6 hectares of agricultural land, 6 hectares with which to feed hundreds of thousands of inhabitants. So you can imagine the need that we have to go outside our city and metropolitan limits to find our food. So this is our initial challenge, to keep our foodstuffs in our territory. This is a very interesting lever with which to work. We have many inhabitants that like to eat. It's a city that is famous for its gastronomy and eating well. We should use our products to benefit that characteristic. And the second thing that's interesting for this talk is our food sensibility. As public health goes, Lyon is not a food desert, but it could be considered a quality food desert. For example, 30% of the people who live in our metropolitan area believe that they live in a situation of food precariousness, and 15% of the people in our metropolitan area never feel as if they eat enough to satisfy their appetite. That leads to some major problems of malnutrition or subnutrition, we could say, which also has a knock-on effect into diabetes, obesity, school absences, overweightness. All of this is interrelated. In fact, these are also echoes of the comorbidities that go with COVID-19. So our food policy is also a public health policy challenge, and we have a two-speed food system. We have people who can afford quality food, and then people who live in more precarious conditions who cannot afford this high-quality food. And so that brings me to one of the projects that we're carrying out in Lyon. It's called the Positive Diets at Home, or Family Positive Diets at Home. It's directed by our local council, and it's part of our food system policy. And it encourages families to return to a high-quality diet. We're working with an association called ADAPT, the Association for the Development of Biological Agriculture in the Lyon area and in the Auvergne-Rhône-Alpes territory. The challenge is for these more vulnerable populations to go back to a higher quality diet, more bio foods, more ecological foods. And to do that, we have to do away with some of the roadblocks that we face. First of all, obviously, the budgetary aspects. We do have to provide some financing for these families. But there are also some cognitive stumbling blocks of going back to a cuisine that works with raw materials. Some families say, this is not for us. They do have this mental block, and there's a great deal of work to be done to accompany them with cooking workshops, visits to farms, visits to markets, outdoor activities that we have in our metropolitan area, all of this to rediscover the joy of cooking and eating together, and to free ourselves from this industrialized sort of diet and implement a comprehensively sustainable diet. There's a few figures on this program. It's a year-long accompaniment program. That's a long period. In 2021-22, the time period that we're now living through, we had 12 families per team, and there are 15 teams. The project began in 2012, in fact, and we've tried to develop since then and expand it. And we've expanded it so much that we're now part of a European project, a European project that will be carried out in all European partner cities. The interesting thing about this is that here we see the figures on the transformation to biofoods, regional foods. We see the 52% that have gone to regional foods and 33% that have gone to bio. And compared to the experience of prior years, we see that these families don't return to the old ways, so to speak. Families that begin to have a higher quality diet continue to keep that diet. A couple pictures of some participants, the children in an activity here. And I won't read the slide to you, but it is interesting to see what it says, and the pride that people feel, and this emancipation and the pleasure of rediscovering high-quality food and the social bonds that come with it. Thank you very much.
For sharing those great examples from Lyon, and really nice to hear that the shifting cooking practices and eating habits has stuck after that program. So we're running a bit behind schedule, so we'll try to keep this moving along and ensure we have time for as many questions as possible later. But for now, we have one more presentation before we move on to a discussion. And for that, I would like to welcome, joining online, Dr. Francesco Branca, Director of the Department of Nutrition for Health and Development in the World Health Organization. So please, Dr. Branca, over to you.
Good morning, good afternoon, and thank you very much for the opportunity to speak. And then congratulations to the city of Barcelona for the leadership in convening this seventh forum of the Milan Urban Food Policy Pact. It's never superfluous to talk about cities as a key determinant of health. We have seen how crowded places are a reason for a rapid spread of viral diseases. But cities are also the place where many of the determinants of non-communicable diseases converge, whether it's air pollution, road traffic injuries, lack of access to green spaces and safe areas for physical activity, but also mental health stress, and then unhealthy food systems. Food systems are a key determinant for our nutrition. And I'd like to remind everybody that we have multiple forms of malnutrition. We have stunting and wasting as forms of undernutrition, and we have overweight and obesity. And you've heard also from the previous speakers that these multiple forms are present in the same ways, in the same countries, in the same cities. The difference between urban and rural exists, but it's relatively marginal. Also considering within cities there are major disparities and differences, and poverty is pervasive. I think we've heard from the city of Barcelona how obesity has different prevalences in different parts of the city. We've heard from Rio how the stunting and obesity are coinciding, and how the remarkable number of 30% people with food insecurity in the city of Lyon. I wasn't aware of this. It's definitely striking. Clearly, the urban environment has certain risks for the development of malnutrition. You have good and bad side. There's access to food vendors, supermarket, and restaurant, but people have to buy the food. They are not able to produce their own food, so people depend on having cash to buy food. So extremely poor urban households spend more than 50% of their budget on food, and they end up buying the cheap, convenient food. Cities, at the same time, provide great opportunities for healthy diets. For example, we have seen how having green spaces is so important to provide some clean air, opportunities for physical activities. But if these green spaces, for example, could also be used for food production, that would be an important way to contribute to the quality of the diet of the citizens. In Sheffield, it was calculated that the use of green spaces could, of maybe just a proportion of green spaces, maybe just 10% of green spaces could provide 15% of the population with the 5-a-day portion. So the cities are a great laboratory for experimenting these solutions, but these things don't happen by accident. They require a clear vision, a clear roadmap for happening, and the alignment of national and local governments. In the food system summit that Gunhild was mentioning in her introduction, WHO was being supportive, particularly one of the Action Track, together with EAT, by the way. WHO has advocated for 6 policy areas that could mean a big difference for the Food System Summit. First of all the reformulation of food and drink products, particularly eliminating industrial trans fat, reducing sodium and sugar. Second, having adequate pricing of food and increasing the price of food that we would like to discourage. So, for example, by having taxation of sugar-sweetened beverages. Third, protecting children from the harm of food marketing, particularly for the foods high in fat, sugar, and salt. Fourth, a clear, easy to understand nutrition labeling, front of the pack and with pictorial and color symbols. Fifth, public food procurement. We've heard a lot about the importance of ensuring that all public institutions, first and foremost, schools, can provide those healthy diets, not only because the people who attend this institution will have a healthy diet, but because the whole food system will be driven toward the production and distribution of healthier food. And then the importance of having food fortification, so bringing back the nutrients that have been removed during transformation. There are clear policy briefs that are describing the evidence of effectiveness of these policy areas, as well as a number of policy tools that are available for all levels of governments to implement these policies. Cities are taking incredible action and in support of this policy area. So we're learning from them. They're spearheading the implementation of these policies. And just to mention some, Sao Paulo, which has enforced a complete ban on billboard on advertising. You see in this picture, the City of London, which has banned junk food advertising on public transport. And of course, Quebec, that has been able, through their restriction on advertising, to reduce by 13% fast food purchases. And also, let me give the opportunity to congratulate with the city of Milan for having won the Earthshot Prize last weekend for their food waste hub. So a lot happening in cities. And there's more. There's more, because city innovation can cover areas such as zoning policies to improve access to healthy food and restrict access to unhealthy food. I mean, even the placement of restaurants can be regulated. The promotion and support of urban agriculture. We mentioned the public institutions and providing good food, but also the social support systems that would facilitate access to healthy food. And initiatives such as soup kitchens or food banks are absolutely critical measures for that. Infant feeding environment, making some areas supportive of breastfeeding. I mean, we have done a campaign a couple of years ago on supporting moms to breastfeed anytime, anywhere. Nutrition training for street vendors, making sure that, first of all, they produce safe foods, but they do not have too much added fat, sugar, and salt in cooking, and food safety and training regulation. WHO has been working with the Bloomberg Philanthropies in a partnership for healthy cities, and you have here a number of very interesting examples of other achievements, and I do hope that we'll be able to connect this multiple city initiatives. I think really we can see how the extension of this initiative can make a big change for also national policies. And just to give you a few examples, the Montevideo regulation stipulating that 10% of all menu items in restaurants be no salt added, or the support in Cape Town of the national tax on sugar-sweetened beverages, including banning sales of sugary drinks in municipal buildings. Cambodia, Phnom Penh was worked on reducing consumption of sugar-sweetened beverages through public awareness campaign. Ouagadougou, nutrition standards for city-owned institution, and then several cities in South America promoting healthy food in schools. So I think we have a lot to learn from each other, but I believe that the city movement is going to be a major transformational element for the food system. Thank you.
Very much, Dr. Branca. Thanks. Well, we've heard a great range of presentations from different experts, both linking to the global context and also giving very specific examples of work in individual cities. We have a few more questions for the speakers. Since we're a bit behind schedule, if it's all right with the speakers here, I will kind of combine and ask you both of your questions to answer very briefly at once. So we hopefully have some time for questions from the audience as well. So we'll start with you, Gemma. A two-part question. Wondering if first you could tell us a little bit more about, you mentioned inequality in different parts of the city in Barcelona, and in your experience in working with school meals, how has the school meals initiative either reflected or impacted inequality in different parts of the city? So that's one part. And then also, it would be wonderful to hear about Barcelona's kind of global commitments towards food systems transformation. So please go ahead.
Sí, gracias.
Thank you. And so far as what are the results of implementing this project of healthy school canteens, we've only been doing this for a few months, but we have tried to implement them in all the districts in spite of inequality. Of course, we have an inequality for consumption of pastry or the sugar drinks, sugar-added drinks, or sweets, or we have an inequality of obesity. We also have that in different districts, but the project of school canteens, we wanted to place it in all the town because apart from mitigating that inequality and rebalancing the diet, replacing animal protein with vegetable protein, we create habits and we help bring in those habits to their homes and to work with the producers around the housing. We saw that that was necessary everywhere beyond the inequality, and we worked on equality with two more projects. One of them is that of health in the district. We have a table of common health in the poorest districts where we work on health and we talk about food, of course, nutrition, and we talk about district with lower incomes, of course, and we talk about the inequality, therefore, and the project of training and awareness in schools. And particularly, we talk about mental health, addictions, and healthy diet. And we work harder on those schools where we see there are more inequalities than the others. But all these projects are all directed and supported by clear indications and by assessments. It is important that we can assess those projects we carry out to see if those policies, transforming processes, if they have good results, and if they haven't, then we'll have to look in another way and to put on the table other policies. And therefore, we are following all of them using indicators compared to other cities or the WHO. And therefore, we follow that inequality on the three levels: on the level of a school canteen, the health in the districts, and training in the schools through community health.
Thank you. And then the second part of the question, just briefly mention, we know Barcelona is very active globally as well, and if there's any commitment you would like to mention.
Yes, I think I mentioned it. The colleague from the WHO has spoken about it. We belong to C40 network, and we have to understand that we have to fight on different projects at the local level, on the level of cities. We belong to this network, C40, and we work with different experiences. It's important that we can share those things that in the town have worked. We can export them to this network, and here we can work on these different commitments. At the same time, we work on these regulating frameworks that we have to revert in order to be able to move towards much healthier diets, and I think we have to face the two things at the same time. We can wait the regulatory framework to change. We know that it's not us who do it, it is slow, but then sometimes it is our activity to make those regulatory frameworks to go backwards. So we're taking advantage of the fact that we were the capital of healthy food this year, but we also managed to apply transforming policies. And for the first time in our time, the community, the municipality of Barcelona has a councillor, and therefore this is a deep transformation that will have to take place in our town on the health level, but also for climate change, for the relationship between town and the countryside, and how we relate. And we relate much better with the countryside, with the farmers. A lot of our population live in the large cities, so we have to tackle these three policies at the same time. I think that this year we have made a very important assessment in our town. We have to keep working with these networks to import and export ideas and public policies from other cities, and we have to keep pushing this regulatory framework forward. We can wait for the state and the overstate to act, but I think that the strength of the cities is really vital for this transformation that has come to stay, and we have to keep working on the climate change and the health crisis that we've had. We've had a different one now, but that of nutrition is not second to any.
Thank you for that expanded answer. And I think that's a big point of the week here, where cities exchanging knowledge, and Barcelona certainly has a lot to teach, and also everyone has a lot to learn. So thank you. The next question is over to you, Andrea, in Rio. Two-part question again. I would like you to speak a little bit more about how you engage different types of stakeholders in the school meals program. And then also understanding that Rio is working to become a leading city when it comes to school meals, and you talked some about the national level as well. And if you could speak a bit about how you're taking this work forward in the international context.
First of all, I'd like to congratulate all the speakers for what you discussed here today. Well, what we've been trying to do now with our program in Rio, we have stakeholders related in the management of the subsecretary with Municipal Secretary Education and Health, which developing a core effectively through implementation politicals of development in areas of human resource, infrastructures, and logistics. We have an urban cleaning, waste managing that now working in solid or organic residues in helping us in the schools also. We have managing city information to communication technology in schools. We have a managed central foodstuffs, which have the proportion for planning, coordinating, and also controlling the procedures of acquisition of supply and food stocks. And I put some points here that I'd like to discuss, not to say. The aim of the Meals Coalition on food systems sections is that if we consider what happened now from the pandemic in terms of food systems, what will happen in employee and rise foods price, Francesco comments, we can see the impact of the number of people who suffer for hunger and malnutrition. In the both way, we have overweight and obesity. So I think that the goal of the coalition is to ensure that every child has the opportunity to receive a health nutrition meal by the year in 2030. I think that also we have aim to improve here a quality of school foods, reducing, as we said here, the content on sodium, the content of saturated fat, the content of soft drinks that children use it a lot. In order to attain these goals, I think that you support your countries to reestablish the effective school meal programs that was lost probably during the pandemic that had impact in the systems. We have also think about reorienting the food and supplies, focus on nutritional value and protecting the environment, which is a difficult pathway to fruit. And to increase accessibility of health food, trying to make a capacity strangers of the retailers of nutrition, motivating the individuals also in the families in communities to eat health diets and to try to change the behavior sport as we saw in here today. So I think to make a change is to say consumption patterns is our great challenge.
Great. Thank you for that further information. And then moving onwards, and if the speakers could try to keep their answers very succinct because we are a bit short on time. Over to you, Gautier from Lyon. If you could speak a bit more about how Lyon is linking locally produced food to the households and the consumers, and then also as a second part, if there are any kind of strategies or goals or commitments that Lyon has in this space.
Yes, thank you for this question. Effectivement, comme je le disais, il y a
Yes, as I said, the challenge is the link between the rural and urban territory. In Lyon, we have the case of 50% of farmers will stop working. And we have to maintain agriculture in the area. It is a challenge which threatens our existence in the cities. What we do in Lyon, we work particularly on training, agricultural training, because we think that those who are trained to do this, they live in the cities. So how do we take them back to the countryside? So we have to invest a lot on agriculture, on urban agriculture, and we have to create social links with nature, with seasons, and creating these rural areas where citizens, dwellers of the city, can give it a try, see if they like it. And I think this is important to create a partnership between Lyon and rural towns, to have an exchange in schools, visits to farms, agricultural farms, and people from the rural areas who come to the city. So we try to make these relationships stronger, since they are very little, to make a relationship with the rural world.
Great, thank you. And I think a lot of cities are in that space of it would be great to connect more with the rural areas while also working to increase local production in the city space too. So thanks. And then over to you, Dr. Branca, a two-part question again. First of all, you've gotten into this a little bit in your presentation, but if you could just sum up in a sentence or two, based on WHO's work with a range of stakeholders, what role can cities play that others are not doing, or what is a gap that cities are well placed to fill in the food agenda moving forward? And the second part of the question is if you could speak a bit about work that WHO is doing to engage cities locally and globally in addressing obesity and inequalities, potentially building on the work of the Food Systems Summit that you also mentioned.
What cities can do, I would say 4 things. I mean, first of all, be inclusive. They're closer to the communities and they can speak to everybody. Second, the policy innovation. Cities can use better their regulatory powers, but can also be creative about projects, as we have seen, as we have heard. Third, to bring together the stakeholders. It's easier to do it at municipality level. Fourth, leadership. I mean, we have many of the mayors are visionary leaders, and they do it because they also want to get their popularity. It's a great opportunity, but let's use that. What can WHO do? I mean, WHO has it in its DNA. I mean, we have in our vision a world where all people enjoy healthy lives and well-being, living in safe and supportive societies and healthy environment as member of an inclusive society. So we really would like to focus on health equity. Cities are an important area, a setting where this can happen. What we do is, of course, raise awareness, convene stakeholders, convene urban stakeholders. We're working with the WHO Healthy Cities Network, the Healthy Cities Partnership, with Bloomberg, but also Breathe Life Partnership on air pollution. We develop tools. So ask us the tools you need, whether it's demonstrating the cost effectiveness of policies or actually bringing the right examples and tools on how to do that. And finally, evaluate progress and become a resonance space for your great activities.
Great. Thanks for that very clear answer. And I think overall we've heard a lot about the value of partnerships, collaborations, exchanging knowledge and tools for these types of urban food systems transformations that cities are positioned to drive forward, especially when it comes to addressing health and inequalities at the local level. So thanks. Maybe a quick round of applause for all of our speakers before we move into the questions. Thanks. And now we have a few minutes, maybe enough time for one or two questions from the audience before we start wrapping up. So I see a hand raised in the second row right here.
Bonjour, Gilles Perron, je suis adjoint au maire de la ville.
Good morning. I am the mayor of a small city in France. We don't hear a lot about small towns at roundtables. We have had a biological canteen. We've had a biological canteen at our schools for 10 years. Since 10 years ago, and the quality that can be provided on the dish, on the plate. We showed it to the families, and families were encouraged to eat more healthily, in a more balanced way. The question is, we talk about healthy eating and obesity, but there are many diseases such as we talk about bio and endocrinology conditions. And what do you think about these conditions which will appear later? Obesity is immediate, but other diseases only appear later. Many things, we'll only see them in 2-3 years. There are children who eat 100% bio, and we have a small town, 10,000 population, but we are carrying out a survey about the food to see the general health of the population in our city.
Thank you for that intervention, and I think that's a good point that small towns are quite active a lot of the time and doing very much. I didn't hear a very clear question in that comment, but maybe if any of the panelists would like to make a quick response. Please, Gautier.
Je peux commencer effectivement, je n'avais pas le chiffre, mais l'objectif dans...
I can start, of course. I don't have figures, but the comment of the school canteens is that of 30,000 children and 20,000 people who eat in the higher levels. Schools, 50% local, and we'll have to work on this because whether it be cheese or meat, there are transformation elements that need to be defined depending on the area. And I don't think there are small towns. I think, as you said, in Barcelona, there are districts, and for the first time, there are mayors who are concerned with nutrition, and therefore we must deal with nutrition at school as well. In school as well, we have to offer a vegetarian menu at school as well.
A quick remark as well, Gemma.
Sí, es verdad.
Yes, it's true. When we carried out this project of healthy school canteens in Barcelona with the Public Health Council, it's not only oriented towards obesity. We know that much fat and sugar, and we know they cause cardiovascular problems, diabetes, and different cancers. So we are looking into different things. I mean, obesity is an indicator. It is something in the short term that is visible immediately, but we want to tackle the general overview of the pathology generated by a diet which is rich in calories, and therefore we look at other. We don't look only at obesity, we look at other diseases which are related to that. Of course, it is important to underline that and to work together towards a wider field.
Thank you. Unless any of our online panelists have something pressing to say in response to this, I think maybe we take one more question from the audience and then we start to wrap up. Any other hands? There's one in the middle aisle right there.
Hi, thanks. I would like to ask Dr. Branca if you could expand a bit on these 6 policies that you have been talking on the food system that it was proposed. If the WTO has some ideas on the interlinkages or the connections we can make with environmental policies. When we talk about healthy cities, we're talking about green spaces, blue spaces, air pollution, many things, no? So how can we match these both approaches from environmental health policies and food security? Thank you.
Go ahead, Dr. Branca.
Yeah, thank you for the question. So definitely what we're advocating for is healthy diet from sustainable food systems. There is a win-win. If we change our diets, we will also reduce the impact of food systems on the environment in terms of greenhouse gas emissions, use of land, use of water. This means having diets which are low in fat, sugar, and salt, and higher in plant food and in wholemeal cereals. So the policies we're advocating for are policies that have been implemented in many countries with success. So we're able to demonstrate the impact of these policies on changes in the diet. Marketing food to children, policies implemented there do lead to changes in consumption. Taxation of sugar-sweetened beverages, the example of Mexico has demonstrated that. Labeling, front of the pack labeling with clear warning. Chile has demonstrated that. So this is a package of policies which have demonstrated their impact in terms of changing the diet in the direction we want. And this can be done in a short time. You don't need to wait 10 years. I mean, the effects that Mexico, Chile have been able to document have been documented in 1-2 years. And these are remarkable. I mean, reduction of consumption of sugar-sweetened beverages in the order of 13, 15, 20% according to the age group and to the social group. So our advocacy will continue in that direction. We have some of those policies implemented by many countries. I mean, sugar taxation is now implemented by 78 countries, but it needs to be implemented at scale if we want it to become a game changer for the food system.
Thank you for elaborating on that. And now I think it's time to start wrapping up. So anyone who has further questions will be around. You can try to find us in the rest of the event. To give some summary remarks, I would like to invite Santi Gomez from the Gazelle Foundation up to the stage. So not an easy task summarizing everything we've heard today, but welcome.
Okay, thank you very much for the introduction, and thank you very much for these inspirational and interesting presentations from 3 cities from all the world, and also from the representative from the World Health Organization. Your cities are great examples of how public regulations and food policies should be developed and combined at the same level and rhythm than health promotion initiatives, and how this combination between policies and health promotion initiatives will give us the opportunity to guarantee a sustainable, affordable, and a healthy nutrition for all the societies. So thank you very much for inspiring us. Also, are examples about how important it is to take into account all the key stakeholders from farm to fork, from garden to fork, to guarantee these sustainable, healthy, and affordable diets. Also, thank you very much, Dr. Branca, for your important highlights and recommendations. As you well know, the World Health Organization is alerting since a long time ago about the importance of taking care about food systems and about tackling some related epidemics like childhood obesity. So now is time more than ever to take action, to implement interventions, to adopt food policies and regulations, and to move forward the discussion. For this reason, the Gasol Foundation, I am here on behalf of Gasol Foundation, in 2016 focused its mission on reducing childhood obesity rates in Spain and in United States, and right now we are going to expand our initiatives to Portugal as well, and through the promotion of healthy lifestyles. As the panelists have mentioned, it's important to take care about 3 action lines that also are basing our strategical plan as Gasol Foundation. First, it's important to implement advocacy campaigns and awareness campaign and use communication and pressure to decision makers to guarantee that all people have access to sustainable diets. One of the main challenges right now here in Spain is adopting a food marketing regulation, especially to protect children against this kind of advertising that can damage a lot their health and their development. The second key action line, also highlighted during the session, is the importance of research and evaluation of all the initiatives and food policies that we are undertaking in all the cities in the world. Is the unique path that will give us answers to move forward the discussion and to make important progresses and accumulate scientific evidence. And the third action line is the importance of health promotion projects that should be implemented, taking into account all the key sectors, all the local key sectors, not only schools, also sports entities, social centers, primary care centers, food distributors, producers, etc. This means that we should take an holistic approach and not only consider children, adults. We should take a holistic approach that includes family units as amazing systems or smaller systems, but amazing systems to implement interventions, and also to consider that nutrition and healthy diets are completely associated with other lifestyle factors like sleep. For example, children that tend to sleep less hours have the double of risk of becoming obese, for example. Also taking care about physical activity in combination with healthy food promotion initiatives, and also the importance of psychological well-being. It's clear how related is psychological well-being with food intake and diet quality. In this sense, also, it's important to highlight the importance of tackling inequalities, as highlighted during the sessions, not only socioeconomic inequalities under the research that we are doing from the Gasol Foundation. Also, we identify gender and race inequalities that should be taken into account to achieve all the goals that we have from now on. So again, thank you very much. It has been a great pleasure of sharing the session with you. And I hope a great day to all the audience here and online. And I hope that this forum will achieve all the goals that have described, because this will mean that we will be closer to achieve the goals of improving food systems from all around the world. So thank you very much and have a great day.
Thank you for wrapping up so nicely, Santi, and it was great to hear about the work of the Gasol Foundation integrated into the topics that have been covered this morning. So I think we're ending now so that we have time to transition this room into the next plenary session, but I'd also just like to briefly give a big thanks to my colleagues Claire and Marius, who put in a huge amount of work to make this session happen, along with the Milan, Pact and Barcelona organizers. So round of applause for them. And the work they're doing to address health and obesity, in addition to other interlinked issues that we're all discussing throughout the week. So I wish you all a fruitful afternoon and good day tomorrow as well, and thanks again for joining.